Welcome to Books for Success. Today, we're delving into the wisdom within Taking Charge of Your Fertility by Toni Weschler, MPH. Discover the route to improved fertility and decode your body signals to get in tune with your reproductive health. You'll learn the Fertility Awareness Method, FAM, to monitor your ovulation naturally. How FAM predicts hormonal issues. About male reproductive health. Subscribe and ring the bell for notifications if you want to keep receiving the knowledge of book summaries about health, wealth, love, psychology, and much more. Don't be shy about dropping your book suggestions for us to summarize. Also, you can use this video as an audiobook summary. Let's grow and succeed together. Be competition for your OB/GYN. Being a woman comes with challenges. Part of the reason is the sensitive nature of female genitalia, which increases the tendency of chronic infections. Another reason is the difficulty of childbirth. A woman endures numerous side effects when using birth control to avoid conception. Advancing technologies gave women access to various ways of pregnancy prevention, but ironically, it created a vicious cycle of contraception and negative aftereffects, which averted our attention from natural remedies. Unfortunately, organic means are heavily considered outdated. So, when Toni Weschler introduced the Fertility Awareness Method, FAM, in 1995, a natural and effective birth control option, women still barely understood their menstrual cycles. For Weschler, FAM is about monitoring ovulation to detect the safe periods, to manage potential pregnancy. The method focuses on 3 fertility signs: body temperature, cervical fluid, and its position. FAM benefits both women who plan motherhood and those who delay pregnancy for an unspecified time. What you're about to learn will help you overcome ignorance, low self-esteem, and confusion about womanhood. Weschler also helps you understand female anatomy, fertility, the menstrual cycle, and the most effective birth control methods. You'll also find FAM helpful when planning a pregnancy. In other words, there will be something to take for yourself, share with your girlfriends, and discuss with your partner. Shall we start? Pregnancy and contraception explained. There is one thing every woman seeks, whether she wishes or avoids conception: safety. The Fertility Awareness Method promotes just that as women learn to register their most fertile periods, thus encouraging or preventing pregnancy. Unlike artificial birth control, this approach embraces natural, chemically uninterrupted processes in female bodies. Put simply, women plan their fertility based on their biological changes. The cervix, a tunnel-like organ of the female reproductive system, plays a fundamental role in conception. Bridging the vagina and uterus, it brings sperm to its final destination. Cervical fluids have 2 jobs: assisting the sperm toward the egg, preventing the sperm from entering the cervix. The condition of cervical secretions can signal fertile times or hint at dysfunction. That said, FAM is essential knowledge for healthcare professionals and menstruating women to prevent any reproductive oddities. The method can detect problems such as lack of ovulation, late ovulation, infertile cervical fluid, hormonal imbalances, miscarriages. Furthermore, learning about FAM can help you avoid several reproduction myths, such as a couple should conceive a child within the first year of their marriage. Miscarriages are easy to notice. Many doctors prescribe ovulatory drugs to intensify egg production, following these myths. Such manipulations can dry up cervical fluid, obstructing sperm movement through the cervix. On the other hand, some doctors refuse to recommend FAM, assuming it is too complicated for busy women. Many believe it requires time and special knowledge, which most women don't have. In reality, FAM requires the basic observance that many females already perform to manage their menstrual cycle. Most contraception aids demonstrate side effects, some of which are detrimental to female health. Oral contraceptives increase the risk of breast and cervical cancer. Intrauterine devices, IUDs, can cause chronic inflammation and painful menstruation. Diaphragms, cervical caps, and sponges can provoke vaginal infections. Aside from health risks, traditional contraception doesn't provide complete protection. Women may often misread the instructions or wait less than required, causing inaccurate results. With FAM, a woman learns to listen to her body and detect oddities. The method requires no artificial substances, chemicals, or side effects. It also enables women to ask the right questions about drug prescriptions and their physical impacts. Become friends with your cervix. Evolution has provided all the conditions needed for successful procreation. Female and male reproductive systems have simple rules if partners decode their body signals correctly. To start with the basics, sperm ejaculation fertilizes a released egg during unprotected or intentionally conceptive coitus. To ensure a happy arrival, semen has a thick consistency to prevent leakage out of the vagina. So you may only notice discharge after fertilizing the egg while the rest of the sperm melts after some hours or days. If you're wondering, sperm makes up about 5% of semen. The rest is fluids from seminal vesicles and prostate glands. In this case, women may appreciate FAM for avoiding the need to care about the amount of ejaculation. As long as women know their infertile periods, which means no egg, fertilization is physiologically impossible. Yet, it's not rare for women to produce more than one egg during ovulation. This phenomenon, known as multiple ovulation, is usually responsible for fraternal twins. Waking body temperature and the state of cervical fluids are the main criteria of fertility. FAM encourages observation of vaginal discharge during ovulation. For instance, changes in cervical fluid patterns are natural during that period. A wetter and stickier cervical fluid indicates high fertility, which happens days before ovulation. Another way to confirm a pregnancy is by observing your waking temperature. Rising body heat usually indicates successful ovulation, while estrogen lowers the physical temperature before the eggs release. Consequently, the temperature rises post-ovulation with suspected pregnancy due to progesterone, the hormone responsible for egg implantation in the uterus. It surges during ovulation and pregnancy, keeping body temperature elevated. You'll also notice an increase in cervical fluid before egg release. Increased progesterone causes an excess of non-fertile cervical fluid that prevents sperm from further entry. Examine your cervical fluids right after your period. Focus on vaginal sensation. Does it feel dry, sticky, or wet? Check if it stretches or breaks. A fertile cervical fluid makes the vagina feel lubricated. This way, you figure out your natural fertility and learn to work with it. A woman's battles are all inside her. While reproduction seems a relatively easy topic, female health is not. Programmed to bear a new human being, a woman's body is intricate and susceptible to reproductive ailments. The most common female reproductive diseases include ovarian cysts, endometriosis, polycystic ovarian syndrome, PCOS. A woman may struggle to notice the symptoms of ovarian cysts. Usually painless, they can grow larger, bringing pain to the pelvic area and even hindering pregnancy. The chances are most women have either experienced ovarian cysts or knew someone with a history of them. In most cases, these formations pose no serious health threat as cysts mostly resolve independently after developing on the ovary. However, it signals the need for more intense treatment if they start swelling or bleeding. The two most familiar types of cysts are functional and follicular cysts. The former develops within the body's regular functions but continues growing beyond the normal size, causing irregular menstrual cycles. As for the latter, follicular cysts originate from egg follicles that enlarge into a cyst, preventing ovulation. Follicular cysts can resolve independently but may still cause chronic pelvic pain. Progesterone injections or surgery can successfully treat these fluid-filled sacs. Endometriosis is another widespread female ailment. Some women may not even know they have it until they try to conceive. During endometriosis, the waste products of menstruation remain inside the uterus, growing as cysts. The early stages of endometriosis can be challenging to detect as it takes time to accumulate the leftover uterine tissue and blood remnants. So, most of the time, it has already spread all over the ovary before doctors diagnose the condition. The symptoms of this ailment are rather harsh, including strong menstrual cramps, extreme pain during penetrative sex, infertility, extreme pelvic pain, irregular bleeding. Unfortunately, endometriosis is incurable, but professionals can remove some scarred tissue to relieve pain. Some non-invasive treatments include hormonal birth control and nonsteroidal anti-inflammatory drugs. In addition, Polycystic ovarian syndrome affects 5% to 10% of fertile women, presenting long-term health risks. The most common symptoms include irregular cycles lasting over 35 days, abnormally frequent cervical fluid release, facial or excessive hair, obesity, inability to conceive. Hormonal birth control and lifestyle changes can help manage the condition, but further professional intervention is necessary. Save time for your future offspring. Fertility reduces with age. Unfortunately, it holds many career women captive, as some decide to have children later in life. But thankfully, with the progress in reproductive endocrinology, women can stop choosing between motherhood and professional accomplishment. As of today, scientists have developed several approaches to solve this problem, with egg freezing being the leader in fertility preservation. Women can now conserve their eggs until they're ready to have children. Fertility starts to diminish about 13 years before menopause. If you'd like to preserve your eggs, seek testing for endometriosis, PCOS, and ovarian cysts. If any of these conditions come up on the radar, you must address them before pregnancy. In addition to aging, these ailments can significantly harm your fertility. Any woman looking to have children in the future must check her ovaries early to know the number of fertile eggs left. The anti-Müllerian hormone, AMH, test and the antral follicle count are standard fertility tests suitable for women of childbearing age. In addition, safe sex also reduces the chances of contracting STIs, preventing the scarring of fallopian tubes and preserving more fertile eggs. If you plan to have children in your 3OS or later, egg freezing technologies may help you. Earlier, only men could preserve their sperm for future use, but now, women too can freeze their eggs in their 20s or early 30s and use them even a decade later. Luckily for most modern women, egg freezing or oocyte cryopreservation is an established procedure with predictable results. Whenever a woman is ready, she undergoes in vitro fertilization, IVF, to conceive a child artificially. However, the success rate of IVF is still low. People looking to freeze their eggs must avoid surgery on their ovaries to prevent their mature eggs from scarring. Also, it's more effective for married couples to freeze their eggs and sperm together. This technology has proven safer and has a higher pregnancy rate with IVF. Your fertility is in your hands. Contrary to popular belief, women are not the only ones to experience fertility problems. Male health is equally vital for smooth pregnancy and childbirth. That said, men must check their fertility as regularly as their opposite-sex partners. The most common tests for male fertility are semen analysis, sperm penetration, sperm DNA. A semen analysis is the most common test to determine sperm activity. To perform it, urologists collect the semen and count the exact number of sperm with normal shape and motility. As for sperm penetration, professionals combine the samples of a man's semen and a woman's cervical fluids to assess sperm activity. Finally, the third test, sperm DNA, requires fragmenting the genes to check a man's fertility. Like in female infertility, hormonal problems and nutrient deficiencies can cause male impotence. But unlike in women, it's easier to detect male fertility issues, yet they take longer to heal. That said, men and women can improve their reproductive health by, first and foremost, changing their lifestyles. Lowering caffeine, nicotine, and alcohol consumption or cutting it out completely is a good start. Focus more on low-carb and low-glycemic diets and drink at least 8 cups of non-caffeinated liquids daily. As for women, premenstrual syndrome, PMS, and menopause are prevailing hormonal battles, with the most popular treatments including prescribed medications like diuretics, antidepressants, or mood stabilizers, osteopathy, hormone therapy, natural alternatives. However, the good news is that medical prescriptions and natural drugs can go hand in hand. Yet, commitment is obligatory if you practice herbal medicine to control PMS. It also means you can switch from herbal to synthetic medication if your symptoms worsen. Diuretics, also known as water pills, effectively reduce PMS symptoms while working on hormonal balance and diet improvement, which can help manage the syndrome. Women going through menopause have to deal with sexual desire and sensitivity loss, lower energy, increased pubic hair, poor calcium levels. Furthermore, acupuncture and acupressure can harmonize your hormones and help you enter menopause with ease. The most important thing to remember is that menopause may jumble your hormones for a while, but it doesn't steal your sensuality. Did you know? A female is born with a lifetime's worth of eggs. Conclusion. Fertility awareness is a vital aspect of a woman's life. Yet, men also bear equal responsibility for healthy offspring. The fertility awareness method is a hidden yet completely natural way for women to manage their reproductive health according to their rhythms. FAM helps women monitor their fertility daily with no external tools or supervision. Furthermore, it enables you to discover your body from a new, even curious, perspective. Tuning to your menstrual cycle may require time and effort, but eventually, it'll bring more benefit and awareness than regular OB/GYN visits. Scientific evidence is another reason to practice FAM. Along with women managing their fertility, men can learn to do the same to ensure healthy children and their own well-being. As a result, you control when or if you want to get pregnant. FAM also educates women on more natural conception and suitable diets to avoid hormonal ailments. For men, procedures like sperm penetration, semen analysis, and even sperm DNA are safe ways to monitor reproductive health and share the responsibility of potential parenthood. Finally, it's worth reminding women that they don't have to give early birth to satisfy societal norms. Either way, you're safe to freeze your eggs and have children when you're mentally and financially ready. Try this. Monitor your cervical fluid. An egg white color signals upcoming or a recently finished ovulation. Try a luteinizing hormone, LH, urine test. This hormone spikes 24 hours before egg release. A slight increase in body temperature follows the fertile window. Measure your body heat regularly at the same time to notice a temperature change. Thanks for being part of our insightful voyage. If our summary piqued your interest, we encourage you to dive into the complete book for a deeper understanding. Don't forget to like this video, subscribe for more content if you're new here, and share it with others who might find it valuable. Keep on reading, discovering, and advancing until our next adventure.